Hi, I'm Chantal Barksdale. I'm a fourth-year medical student.
Hi, my name is Hahn Nguyen, fourth-year medical student.
I went and rotated at Partners in Hope in Malawi. One important thing for me in doing a global health rotation was to get exposure to the way that medicine was practiced in low-resource settings. It was really powerful to go to Malawi as well because there's already a strong working relationship between UCLA and Partners in Hope. And that was one of the main reasons that I chose this site.
I had an amazing experience practicing sort of clinical care at the clinic there. My previous global health experience was analyzing HIV and TB care and the implementation of the treatment protocols. And so it was really great to actually be able to participate in delivering that care to HIV patients in that clinic. You know, that's not something that we see here often in the US, so that was really unique.
One of the take-home stories from my rotation there was during an encounter with a patient where we were prescribing them with antiretroviral therapy and with antihypertensives, and we're able to give them those prescriptions. But even though the patient was also taking aspirin, we didn't give them a prescription for that. And so I was just curious and asked the clinical officer in the clinic why we had not prescribed the aspirin. And he shared that aspirin is incredibly expensive to prescribe in the clinic. And so he just advised that patient instead to go to a local pharmacy and get that aspirin at a more affordable price. And what I took away from that is just an amazement in how these clinicians were able to navigate the health system in Malawi and the broader context in which patients live, and take that into account and provide medicine that was actually going to be affordable and that people were actually going to be able to adhere to. And that's something that I hope to take back with my practices in the US and abroad in the future.
We had a lot of medical students rotate through that site as well, and we actually were responsible for some of the didactics, so you can be involved in medical education and global health. So I think that's what became clear to me during this experience. It doesn't have to necessarily be clinical care.
I think doing global health rotations continues to challenge one's practice of cultural humility, and that was definitely something that I took away from it, is going into a place that I'm not familiar with, learning new customs, new values, new ways of doing things, and trying to treat people in a way that they want to be treated. I think that's a skill that you can take no matter where you practice, and that was something that I was able to work on during my time in Malawi.
Kind of one important thing that I learned just in general about being a physician is that the patient experience is so shaped by you. It starts with you and how much care you show that patient. I've witnessed here in the US, doctors sort of callously tell a patient that they had cancer. And in Malawi, I saw the same thing, and there was just like so much compassion from the doctor, and the patient was engaged, and it was just a really eye-opening sort of experience to see. So it doesn't really matter what resources you have, it really starts with you as a physician.
I left the rotation knowing that everyone deserves access to healthcare, and I'm really passionate about healthcare equity, and I felt like participating in global health is a great way to do that, and I'm just going to continue to try to negotiate that on my own terms and make it work for me.